Liver Transplant Evaluation and Listing at the University of Washington Medical Center, Part 2. Welcome. In this transplant educational segment, we will review what to expect during your liver transplant evaluation, as well as what to expect once you're listed for liver transplant. The University of Washington's liver transplant program is honored that you've chosen us for consideration of transplant. Most patients meet with the liver transplant team when referred for an initial consultation. Other patients may be seen in our liver tumor clinic or even in our general hepatology clinic. No matter where you start, it will be during this initial visit that our liver transplant hepatology team will decide if liver transplant may be an option for your liver disease. The liver transplant evaluation process can be challenging for many patients. You will be asked to travel to the transplant center for 2 to 3 days of medical testing, including many visits with our consulting services. You will need to complete additional testing with your local doctors, and finally, you will need to review and sign transplant program policies. In addition to the medical evaluation, patients need solid care support and stable housing. Having caregivers to help before and after transplant surgery is key to a successful transplant outcome. Some patients with long-standing alcohol use or other addiction issues may be asked to enroll in local chemical dependency treatment programs to help develop sober strategies and to gain better insight into their addiction disorder. As you can see, our transplant evaluation is lengthy, but it helps our team to correctly identify the cause of your liver disease and then to determine if transplant surgery could be a treatment. In this slide, we will review the process for liver transplant evaluation. Transplant patients are referred to the University of Washington Medical Center by a patient's primary medical team. Once a referral is received by our facility, an appointment will be made in our liver transplant clinic, at which time you will be seen by our transplant hepatologist. Our transplant hepatology team is focused on liver disease and will determine if a transplant evaluation is needed. After meeting with the transplant hepatologist, your transplant coordinator will provide you with additional information for the transplant evaluation. Medical testing will be scheduled at our transplant center at the Montlake campus, as well as many transplant team visits. Some testing such as colonoscopy, EGD, pap smear, mammogram, DEXA scan, dental clearance, and additional urine testing can be completed with your local providers. Transplant policies will also be reviewed, and you will need to sign and return these to your transplant coordinator. For those patients who are referred to our program through our liver tumor clinic or general hepatology clinic, you will receive a packet of information by mail. Please make sure that you reach out to your liver transplant coordinator should you have additional questions as to how to complete the required documents, as well as the medical testing. Remember that all patients have their transplant evaluation at our Montlake location. Medical testing includes imaging of your liver, such as CAT scans or MRIs of your liver, chest X-ray, echocardiogram, cardiac stress test, pulmonary function testing, blood and urine testing. You will have consultations with many departments such as social work, nutrition, anesthesia, and transplant surgery. If abnormalities are found during your transplant evaluation, you may need to return for additional testing and to see another specialty clinic, such as cardiology, pulmonary, or our nephrology team. Please remember that all appointments for your transplant evaluation will be at our main Montlake campus. Once your major medical testing is completed, your transplant coordinator will submit your transplant case for review in our Liver Transplant Selection Conference. Our Liver Transplant Selection Conference meets once a week to determine if a patient is a suitable candidate for liver transplant. Our transplant center follows a selection criteria when reviewing all medical cases for transplant acceptance. This ensures fair and non-discriminating distribution of organs. Delays in completing required medical testing will delay your case from being reviewed by our selection committee. It is your responsibility to let your transplant coordinator know where local medical testing has been completed so test results can be received in a timely manner. In addition to the medical testing and transplant insurance coverage, a patient's psychosocial evaluation also plays a role in determining transplant candidacy. During our selection conference, a patient's medical testing is reviewed by our selection team. Should a candidate's medical and psychosocial testing be favorable, a patient will be approved for liver transplant. Similarly, should a candidate's medical and/or psychosocial testing be unfavorable, a patient will be denied for transplant. Be aware that most patients' initial decision will not be approved or denied. Instead, we use the term deferred for liver transplant. Deferred means that a decision for transplant candidacy cannot be made, as additional testing or other recommendations will need to be addressed prior to acceptance by the committee. Patients can be deferred for many reasons, such as abnormal heart or lung function. Patients can also be deferred for psychosocial issues, such as limited care support, need for stable housing, or enrollment in substance abuse treatment programs. Patients who are deferred will be asked to complete needed items in a specified time frame. After this time, the case will be reviewed again, and a final decision of approved or denied for liver transplant will be determined. Patients will be sent a letter summarizing additional testing or recommendations they need to complete for the committee in order to make a final decision. Please be sure to obtain your letter from your local post office so that you can review the committee's decision regarding your transplant candidacy. Care support can be challenging for some patients. We require patients to have caregivers who can be available for overseeing medical care, attending medical appointments, supervising medication administration, as well as providing emotional support. Your team of caregivers will need to stay with you after transplant surgery for about 3 months. Make sure you talk with your social worker if you are having difficulty in developing a solid care plan. Let us now discuss the process for transplant listing and what to expect while you wait for organ transplantation. The United Network of Organ Sharing, better known as UNOS, is a private, nonprofit agency that works with the federal government to facilitate organ transplantation. When you hear our transplant team say you are listed or waiting on the wait list, it is the national UNOS waitlist that we are referring to. UNOS holds the database of patients eligible for liver transplantation and matches them with compatible donors. We encourage you to visit the UNOS website, where you will find lots of information about liver transplantation and other resources for patients and their caregivers. Most patients assume that once a liver transplant evaluation is initiated, they are also approved for liver transplant candidacy. Acceptance for liver transplant candidacy is a long and complex process. Upon completion of your transplant evaluation, your medical testing and psychosocial history are reviewed in our liver transplant selection committee to determine if you meet our selection criteria requirements. Once approved, your medical evaluation is submitted to your designated insurance carrier to certify active transplant coverage. Once coverage is certified, your transplant coordinator will contact you to obtain a local blood test to list you for liver transplantation. Your information is then entered into our transplant database within the organ network. Patients are listed with required demographic information such as name, ID number, blood type, height, weight, and other qualifying information that will be determined by your transplant hepatology and surgical team. All patients receive notification of active transplant listing by telephone and by mail. It is important to remember that active transplant listing is based upon active transplant financial coverage. Therefore, should you have any changes with your insurance benefits or insurance carrier, it is your responsibility to inform our financial team. Failure to do so can result in lapse of coverage, which can impact your transplant candidacy. As you move forward in this transplant journey, you will hear about your MELD score. The MELD score, MELD, uses blood testing results to calculate how sick a patient is from their liver disease. UNOS uses this score to match patients for liver transplant. MELD scores can fluctuate from a low of 6 to over 40. A patient with a high MELD score has a higher probability of getting matched for a liver transplant. Once listed for transplant, UNOS requires frequent blood testing to keep a patient active on the transplant list. Most patients will need repeat lab work every 3 months. Some patients with higher MELD scores will require monthly or weekly labs. The pre-liver transplant team will contact you with required lab work frequency. Completing your lab work testing when required is necessary to requalify you for active listing. Patients that do not complete their lab work when asked will lose their spot on the waiting list. Your transplant coordinator can offer you additional information about your MELD score and what you should expect when you get listed for liver transplant. Although the MELD score is used to match a candidate for liver transplant, there are exceptions to this rule. There can be patients who have a very low MELD score and a unique medical condition that qualifies them for a liver transplant. Patients such as this will more than likely not match for a liver due to their low MELD score, yet they carry a statistically high likelihood of dying from their liver disease or medical condition. To correct this inequality of organ matching, the organ network has developed MELD exceptions. For patients who have certain medical conditions, UNOS has set in place a process whereby a patient can be given extra points added to their natural MELD score to help them match for a liver transplant. This process is highly regulated on a national level. Medical conditions which qualify a patient for additional points is set forth by the organ network. Patients who have unique medical conditions who could benefit from MELD exceptions will receive counseling by our transplant hepatologist. In addition, your nurse coordinator will be able to provide you with additional information should MELD exceptions pertain to you and your liver disease. Many patients ask, how does a liver match to me? Liver distribution is complex and difficult to understand, as the organ network has set up a matching method so that the sickest patients get matched with livers first. There are cases of liver disease that are life-threatening, and those patients designated as status 1A and 1B will receive high priority for liver transplantation due to high probability of death. Allocation of livers has changed over the years. As you can see in this photo here, the organ network distributes organs based upon nautical miles from the donor hospital. Patients are matched according to a variety of factors, including their MELD score, age of the donor, and mechanism of death. Many patients express stress and anxiety when they first get listed for liver transplant. Patients get concerned they will miss a phone call stating they've matched to a liver. Patients also express anxiety they may die from their liver failure. But these are normal feelings. Have confidence that the University of Washington's liver transplant program is well regarded in the Pacific Northwest and nationally. We have successfully transplanted many patients since 1990. Our surgical team is available 24/7, 365 days a year. Even during the COVID pandemic, our transplant center never shut down, and we continued to successfully transplant many patients. We want you to be a successful transplant recipient. Your job is to take care of yourself. This means, while you wait for liver transplant, you must continue with routine medical care with your local primary care physicians and local gastroenterologists, as well as taking all your medicines as prescribed. Continuing with good nutrition and daily exercise can help keep you in check for future liver transplantation. Some patients may need nutritional supplements or even tube feeding prior to transplant. Our transplant nutritionist will work with you in determining your best dietary needs. Remember, to remain active on the liver transplant list, you will need frequent blood testing. Our team will reach out to you when required lab work is due. It is your responsibility to get your blood work completed and to notify our team the day you go. Many patients will ask, when will I get called in for transplant? This is difficult to predict. No one knows when you will get matched for a liver unless you are moving forward with a living donor liver transplant. If your MELD score is high, your transplant nurse coordinator will keep you informed so that you are aware that transplant may be imminent. Although a person with a higher MELD score has a higher likelihood of matching first, any patient who is listed for a liver transplant can be called in. Therefore, it is imperative that patients be prepared to be called in for a liver transplant at any time of any day. Make sure you have travel plans in place, as well as child care and pet care. Patients who will need local housing after transplant should have plans already in place. We encourage patients to purchase a thermometer, weight scale, and blood pressure machine now, as these will be needed when transplant occurs. Remember to update the transplant center with any changes in your medical condition, especially if you're hospitalized. The transplant center must be notified of any changes in your mobile phone number, home address, or changes in your care plan. In addition, you must let your transplant nurse coordinator know immediately should there be changes in your transplant insurance benefits. It is also your responsibility to notify our financial team with any insurance benefit changes, as this can impact your transplant candidacy. As you wait for liver transplant, routine clinic appointments and any needed imaging will be scheduled at our transplant center. For those patients who live far away from the transplant center, you will be required to travel to our transplant facility for checkups as directed by the hepatology team. This can be difficult during the winter months, as well as costs incurred by patients who do not get travel and lodging benefits from their insurance company. This, however, is part of the requirements of remaining active on the liver transplant list. At each visit, your liver function and transplant candidacy will be assessed by our hepatology team. In addition, the transplant center will schedule yearly cardiac testing as well as annual social work and nutrition consults. It is important for you to maintain routine cancer screening with your local providers as well as annual dental exams. Maintaining good communication with your transplant nurse coordinator will be key as you continue onward in your transplant journey, especially if you should have changes in your health or become hospitalized. Thank you for watching this segment on your liver transplant evaluation, transplant listing, and what to do while you wait for liver transplantation. Should you need additional information, please reach out to your transplant nurse coordinator. You can now move on to Part 3 of this educational seminar.